Next up on the agenda is Dr. Helen Patrick. Helen is currently in her final year of the 3-year Genomics NHS Scientist Training Programme, working at Sheffield Diagnostic Genetics Service within Sheffield Children's Hospital, and she'll be talking to us about careers in public health.
Thank you, Matt. I'll just share my screen now. Is that sharing okay?
Yeah, that looks good, thanks.
Great, so thank you for the intro. I'm going to speak a little bit about, well, I won't go over my own background again, what a clinical scientist actually does, the programme itself, and a little bit about the application process as well. So yeah, I won't bore you with all of this. But just to mention that although I do have quite a research heavy background, people from all sorts of academic backgrounds will apply for the STP. So it's not to say that you have to have a PhD to get on the programme, so please don't get put off by this. I'd say in our cohort it is probably 50-50. What matters more is the skills you've acquired in whatever you have done previously, and how these skills fit the person's spec of the clinical scientist. So you all have experiences and skills which fit like the NHS constitution and things like that in different ways. So my talk will be focused primarily on the genomics specialism of healthcare scientist. And this slide demonstrates there is a wide range of specialties available to apply for in the STP, not just genomics, so anything from andrology to vascular science. The specialties do change each year based on demand from NHS departments, so you'll need to check whether the subject or specialism you're interested in has posts to apply for that year or not. Not all specialties are recruited to each year. So I applied in 2020, just pre-COVID, so quite a few things have changed with the application process since then. But now you can only apply for one specialism, so that's worth bearing in mind. So I applied for genomics and cancer genomics, but you couldn't do that now. So a healthcare scientist in genomics is mainly involved in the analysis of data. So this involves the diagnosis of many different genetic disorders. And this may involve analysis of next-gen-seq or Sanger sequencing, carrier typing, variant analysis, and all sorts of other types of analysis. So as scientists, we also write clinical reports. These are then sent on to the referring clinicians who act on the results that we report. There is opportunity for service development, and this may include development of new assays or new types of analysis. As an example, whole genome sequencing has gradually been introduced as part of routine care for children with cancer or rare disease. And this is following on from the success of the 100,000 Genome Project, and this is really going to sort of directly impact patient care and outcomes. That's quite exciting. One thing to really highlight is that healthcare scientists actually do very little lab work, at least especially in genomics. So this is something to really consider if you're thinking about applying. In Sheffield, we've been working from home since COVID. We've only just started going back into the office once a week. So yeah, this isn't for everyone, so it is worth bearing in mind. We're able to sort of remote in and analyse the data from home. So this role is nothing like being a research scientist. So it's important to sort of distinguish between the two types of scientists. There's other aspects to the job too, such as management, audits, quality control. It's a sort of job where you'll be constantly learning, which I love. The field of genomics is changing so much at the moment. It's like, yeah. There's also a big element of responsibility when reporting results, since this is likely to impact patient care and treatment, as I mentioned previously. It might also affect the patient's family members, whose risk and screening will be dependent on the result that you've reported. So this is quite specific to Sheffield, but this is our departmental structure. But you can see that there are many services within genomics that you could then work for once you qualify. So this could be within oncology or rare disease. So there are quite a few sort of niche specialisms within this. So a lot of you might already have heard of the STP. It's a graduate entry training programme. It incorporates a fully funded master's degree in clinical genomic science. So even if you already have a master's or PhD, like you will be required to do this additional master's, but it's fully funded. And we get sort of study time out of our work to do this studying exams and things like that. So we're not expected to work evenings and weekends to keep on top of the studying. You'll be employed by the NHS for 3 years at band 6. And although you then do need to apply for a permanent job at the end of the programme, it's quite common to be kept on by the trust who have hosted you if that's what you'd like to do. So I've still got until next September, but I've already managed to secure a job within the department, so that's quite a relief. So I wouldn't worry too much about sort of securing a job afterwards. They tend to take on the sort of number of trainees that they think they're going to need in 3 years' time, so there should always be a position available. So once you've qualified, healthcare scientists are employed on band 7. There is then also the opportunity to do a higher specialist training qualification at any point in your career following the STP. So this is a 5-year programme, sort of equivalent to a PhD. So as I mentioned before, the programme has changed since I started, so forgive me if there are some slight inaccuracies here. I've tried to brush up on what you would be doing if you did apply now. So this information is all available on the National School website. So I'll quickly go over the next few slides in the interest of time. So the first year of the programme consists of 4 rotations. So these include genetic and molecular science, cancer genomics, genetic counselling and bioinformatics. So I did all of these apart from the cancer genomics in first year, so that's the change there. But genetic counselling in particular was so interesting. It's a patient-facing role, so it's totally different to what we're used to in genomics. So I've got to observe lots of patient appointments with consultants and genetic counsellors involved in Ehlers-Danlos syndrome service. There are prenatal clinics, inherited cancer clinics, where they were discussing sort of BRCA genes and Lynch syndrome, which you might have heard of, and other cancers, associated genes like that. I also got to explain patterns of inheritance and risk to patients, take a family history, draw pedigrees. We had non-verbal communication training, and we're involved in referral meetings and MDTs. So then the bioinformatics rotation, you'll learn how to code and build an NGS pipeline. So this involves aligning sequencing reads, calling variants, filtering data, classifying variants, and so on. So no coding experience is needed though, so don't worry about that. One good thing about the STP is you are sort of completely trained from sort of a very basic sort of level, because everyone's going to have totally different backgrounds. So you don't need to worry about being an absolute expert in all of these sort of specialisms already. And so in second year, there are 4 specialist modules. So this includes pediatric, prenatal and adult genomics, as well as another oncology module. So as well as these modules, we also carry out a research project across second and third year. So this could be wet project, say lab-based, or dry desk-based project. And it's an opportunity to explore a specialist interest. So the master's degree should take up about 20% of your time, so 1 day a week. And as I said before, you're allocated study time, so you're not expected to be doing this in your own time at all. So for genomics, the master's is done with Manchester University. So to apply for the STP, you must have an honours degree in an area relevant to the specialism you are applying for. There's also a situational judgment test to do when submitting your application, which I didn't have to do, so I might not be able to answer too much on that. So applications are managed centrally, so you don't apply directly to your preferred trust. It's a national programme. So with your application, you would rank your location preferences. I'd recommend being as flexible as possible with your locations if you can, just to increase chances of getting a place on the programme. When you are shortlisted, this would then involve ranking of your application score and your location preference together. And so if you are successful, you are now allocated 1 interview with the host trust. And this would normally be with 2 scientists, so head of department and training officer normally. So keep an eye out for dates on the National School of Healthcare Science website, because they've not been released just yet. But applications do normally open in January, ready for a September start. So as you're probably aware, the STP is a fairly competitive programme. It does sort of vary depending on which specialism you apply for. So haematology was the most popular in 2018, so this is the most recent data available online. So they had a competition ratio of 113 this year. So way more people were applying for each post than positions available. In the past, genomics has been more than 40 people applying per post, but in 2018, there were only 16 people applying, and this is probably because there's just more positions for genomics available at the moment. There's an increase in demand for clinical scientists in genomics, sort of due to the advancing technologies, such as whole genome sequencing that I mentioned, so they just need more analysts. So this is good news for everyone applying. So there's a few resources here. I think these slides are going to be available to you afterwards, but I'd really recommend having a look at the National School website. There'll be an awful lot more information on there, as well as dates for applications, deadlines and things like that. I believe that the STP Open Days are also advertised on there, so keep an eye out for them because they're really useful when you're writing your application. So thank you. Happy to take any questions.